Francis asked me if I would sort of speak about, the importance of this work and getting trained people in this area. And in our discussions, I said to Francis, terminologists are really the key to the success of all the work that we're doing. They're key to the present work that we're doing and to all the future successes that we will have in digital health solutions work. The precision of language in health communications matters. And it's really important that we have technologists or terminologists that understand these standards and how they work, so that information, when it's shared from one system to another or from one provider to another, is not, as I like to call it, lost in translation as it's moving from one system to another. And it really takes people with this critical skill set to help do this type of work, to ensure that when we're working with systems and solutions and providers and patients, that everything that we do keeps patients as safe as possible and reduces any type of risk that we can. So I told Francis I'd provide a little bit of an example here, and we talk a lot about this in the work that we do, and we're trying to sort of explain the value of health terminologies. And if you look at how information is sent from one system to another, it's sent up in what we call an HL7 message. And lots of times you just sort of get little bits and pieces that are sent in the message. And so the question was, if I would just send the word cold, how would I know if a person was actually shivering, had a rhinovirus, or was talking about cold temperature itself? So this is a real example here that I provided to Francis for today that shows this work being done in SNOMED. So imagine again, just receiving the word cold in your information system. It's been sent to you from one provider to another. You really want to know exactly what I was talking about. So in the next slide, you can see here, this is a SNOMED CT example, but you can see here how SNOMED has modeled this. We see here that this code number, which is 45893009, reflects cold weather. The person was describing cold as in cold weather. In the next example, again, the same word, cold, but now you can see there's a different identifier, 84162001, that talks about the fact that I was experiencing the sensation of feeling cold, versus the last example that I provided, which is again the word cold, but now a different identifier, 822-72006. And in this case, you can see that I've got a nasty rhinovirus. I've got a cold, as we normally think about it. I've got a box of tissues next to me. And so when the concept of cold, the doctor knows exactly what I'm talking about because I'm there in front of him and he has complete context. But there's a risk that context is lost when information is conveyed from one system to another or from one provider to another. If we use a medical terminology like SNOMED CT with numbers that are behind this, so the clinician's entering cold in the front end in the system, but the system itself in the back end is capturing these numbers. Then, when the information is shared from one person to another, one provider to another, one system to another, it's the number that goes. And then it's looked up in a terminology service. And now I know that whether or not I was actually feeling cold, I was talking about the cold weather, or I had a rhinovirus that was giving me a cold. And so I'm hoping that this very simple example will sort of set in further context the importance of this type of work and the importance of having people that are skilled and trained in this area to help us put this all together, so that when we are sharing information, and our goal is to capture it once and share it many times and let it be reused, that everything is maintained in context, because we know the precision of our language matters in healthcare.